This is Dr. Gunn Nolan with the Sova Health update for our community in regards to our COVID-19 status. At this point, we continue to fight this fight, and we have more than 45 patients across the market receiving treatment for COVID-19. It's important to note that 97% of those patients were unvaccinated. We continue to address the issues in regards to staffing, resources, concerns that continue to occur as we ongo this battle. I can't stress enough the need for vaccination, but I also can't stress the need to make sure you're getting your emergency service care within an emergency room. Likewise, if it is not a life-threatening emergency, we do encourage you to go to an urgent care. Go to your primary care physician, seek other means of those resources so that we can preserve those emergency resources for those that need it. I do want to note that our emergency department is also not a community testing center. There are resources available within our community to make sure that those that need it get a COVID-19 test. At this time, I would like to introduce Dr. DeWong. She works here at Sova Health Danville as a hospitalist and has been on the front lines of treating COVID-19 with many of her colleagues. I've asked her here today so that she can talk about flu. We know flu season is approaching rather quickly, and our COVID-19 status. Dr. DeWong?
Yeah, so I just wanted to talk a little bit about the flu this year, because I know it's coming up. With the numbers of COVID-19 cases coming up, there's a lot of concerns that we'll also see flu with the co-infection with the COVID-19. Last year, we were able to avoid a lot of those flu numbers just with the masking. But this year, since there's been less masking and more unmasking, we will likely see more flu cases. So I just want to encourage everyone to get vaccinated, both with the COVID-19 vaccine and with the flu vaccine. You do need both separately in order to avoid the COVID-19 and flu.
So it's important to note that even before the days of COVID-19, flu has taken many lives. As with any vaccine, it doesn't necessarily eliminate you from getting flu, just like the COVID vaccine can't completely prevent you from getting COVID-19. But it does decrease your risk and make it a lot less severe. Our goal here is to decrease the number of people's lives that get taken. I do want to note, because there's been a common misconception that continues to occur, it's important even if you've had COVID-19 to get the COVID-19 vaccine. Studies have continued to show that the immune effects of COVID-19 from someone who's recovered doesn't necessarily last. We want to make sure those within our community are fully protected. Thank you.